Time is just after 3 o'clock. My name is Chris Osborne. I am the Public Information Officer for the Jefferson County Unified Command. Today we'll be having an update from members of the Unified Command. And without further ado, Dr. Mark Wilson.
Hi everybody. We wanted to speak to you today in just an effort to keep the public well informed about where we are in the COVID-19 vaccination process. As you probably know, the Alabama Department of Public Health has developed a COVID-19 vaccination allocation plan for the state using guidance from the Centers for Disease Control and the Advisory Committee for Immunization Practices. The plan spells out various phases which puts various categories of the populations in order of priority for getting the vaccine. The vaccination providers in each county are supposed to work together to make sure most of the people in each of those phases or subsets of those phases have been given the opportunity to be vaccinated before we all move together to the next phase or subset of a phase. So we're following that plan in Jefferson County. The Jefferson County Healthcare Coalition helps make sure vaccination is coordinated as much as possible and helps us decide together when we're ready to move on to that next level. Julie Cobb, RN, who's our Healthcare Coalition coordinator, is here with us today if there are questions later. Alternatively, the state may tell us when it's time for us all as a state to move forward to the next phase. So currently in Jefferson County, we are still in phase 1A of the allocation plan, which includes healthcare workers, emergency medical service providers, and residents of long-term care facilities. We still have some more people that are in phase 1 that still need to be vaccinated, and we're working on getting them done this week. Now the state did announce that we will be adding 2 categories of people to start vaccinating by next Monday, January 18th. That's statewide. And those 2 categories are people age 75 and over. That's all people age 75 and older across the entire state. And the second group is other first responders who have not yet been vaccinated, such as law enforcement and firefighters. The total for those 2 groups in Jefferson County is approximately 47,000 people. So that's a lot of people just in those 2 groups. We'll be in communication with various vaccination providers, such as our area hospitals, this week to see if it is possible to start vaccinating these 2 additional groups before January 18th. But we're not sure at this point whether we're going to be ready to move before the 18th. But on the 18th, we will start vaccinating these 2 groups. Again, those are people age 75 and older and all first responders. Now, some of you may have heard mention of moving on to phase 1B, but I want to make sure everyone understands that we will not be vaccinating other people in phase 1B starting on the 18th. We don't know how long it'll take to get to that point, but it could be a few more weeks before we get to those. It really depends on the supply of vaccine, which is still coming out in limited amounts. Jefferson County Department of Health is currently using its allocation of vaccine that we as a health department have received to vaccinate some healthcare workers at a couple of hospitals, in addition to other people in 1A. As we move forward, we're quickly moving towards setting up some vaccination sites in other locations in the county besides here at our main health department location to make sure there is equitable access across the entire county. And there are other healthcare providers and pharmacies in Jefferson County that will be receiving vaccine in the near future to help us provide additional access points. So we ask that all of those providers do work with us and our Healthcare Coalition to make sure we are coordinating our efforts and continue to share valuable information with the public on how to access vaccine and where they can access it. A week ago today, we set up a COVID vaccine call center at the Jefferson County Emergency Management Agency, or EMA, to help people get information about the process, and if they are in the current phase, to make a request for vaccination if they've not yet been vaccinated. Now, the Alabama Department of Public Health later last week did set up a statewide call center, but please note, if you live outside of Jefferson County, use the Alabama Department of Public Health call center. But if you live in Jefferson County, use our call center, because the state health department's call center is not making appointments for Jefferson County residents at the Jefferson County Department of Health. Now, you do not necessarily need to use the call center if you already have access to vaccination through some other means. The main purpose of the call center, as we set it up originally, was just to make sure that no one who currently qualifies for the vaccine doesn't fall through the cracks. We're keeping a list and keeping people's contact information so that we can circle back with them with opportunities to get the vaccine if they haven't had it yet. The call center is not exactly an appointment center, but it's a way just to help make sure people are linked to those entities that can schedule appointments. So finally, I just really ask everybody to be patient. There is currently a limited supply of vaccine, and we have a lot of people to vaccinate. It's a big undertaking, lots of logistics. We're going to have hiccups, but we're going to work really hard to get there as fast as we can so we can get enough people vaccinated to get out of this horrible situation we are with this pandemic. So with that, I'm going to call up Director of the EMA, Jim Coker, who will talk about a little bit more about the call center. Thank you.
Hey, good afternoon. As Dr. Wilson said, a week ago, working with the Department of Health, we established a call center. Initially, this was only by telephone. Over the weekend, late Friday afternoon, we established a self-registration feature on our website. So the easiest way to do this is to use our website and the self-registration feature. We've had over 13,500 self-registrations since Friday, over 3,500 telephone calls since last week. So to reach us, please go to our website, which is jeffcoema.org. Look for the green button, and you can register yourself. If you'd like to talk to a person, please call 205-858-2221. And I'd like to introduce Chris Tate from our office, who was instrumental in setting up the call center, and he can give you a little bit more technical details. Thank you. Chris?
Hey, good afternoon. Again, my name is Chris Tate with the Jefferson County EMA, and my role was to assist, as we have been from the beginning, all of our community partners, including, of course, Jefferson County Department of Health, in achieving our goal to try to make this COVID incident go away as quickly as we possibly can. And so our role this past week, again, was to set up that call center and to make a method in which our citizens, those who live and work in Jefferson County, that can go online or call, talk to somebody, get information about eligibility and what the process is moving on in the future. So if there are questions later on, I'm happy to answer those specifically about call volume, anything about phases that pertain to the call center, and that is all I have. So I will turn it back over to Dr. David Hicks with JCDH. Thank you.
Hello, everyone. I'm Dr. David Hicks with the Jefferson County Department of Health. I serve as the Deputy Health Officer. Right now in Jefferson County, we have over 59,000 reported cases of COVID-19 since this pandemic has started. And that amounts, unfortunately, to 784 deaths in our county. And that's way too many. As far as our hospitals go, as of yesterday, 632 people are hospitalized currently in Jefferson County with COVID-related illness. 139 people are on ventilators, 221 individuals are in the ICU, and unfortunately 10 people passed away yesterday due to COVID-related complications. We still have to redouble our efforts, and we are encouraging the general community to remember the 3 W's. Wash your hands, wash your distance, and wear your mask. So we also want to encourage people to minimize any unnecessary gatherings because we see that the rates of COVID in our community, the rates of positivity that's in our community is the highest it's been since this pandemic. So anything that you can do to help out, any unnecessary gatherings is going to be important because we know COVID is spreading in these close interactions that we are having. Those interactions that we may be having with our friends and family members. And sometimes we put our guard down at times. And that's the time when we need to put our guard up potentially the most. Now, it's still important to do testing, even though we're moving into this vaccination phase. Why is testing important? We still have to identify these cases that are out there. We have a significant amount of asymptomatic spread going through our community. And it's going to take a while, months, to get enough people vaccinated to get to the herd immunity to get out of this pandemic. So we still have to identify the cases and do those 3 W's that I mentioned earlier. Now, as far as testing goes, if you go to the health department's website, and that is jcdh.org, there's a banner that slides across the screen that says coronavirus. Click on that banner, then you're going to scroll down. When you scroll down, you're going to see COVID-19 testing locations, and that you will be able to see all of the community testing locations that are currently set up with times, days that they're operational, and any other pertinent information. So remember, still get tested right now. Another quick little point, even with the people that are getting vaccinated now, there's still a chance until you get that full immunity protection that you can still contract COVID-19. So if you get vaccinated, it takes a few weeks to build up immune system protection, but you still need your second dose. So we're still going to be wearing masks for a while until we get enough people vaccinated. And with that, I'll conclude my comments, and then I'll give the floor to Chris Osborne.
Okay, at this point, we will take some questions from reporters and photographers and other media in the room, and then we will move to questions that will be taken from our Zoom call. We will start with Dr. Mark Wilson. We'll come back up to the podium. Thank you.
Dr. Wilson.
Yes, sir, over here.
Okay. Thank you, Dr. Wilson. What's the status of vaccinating all of the 1A members in Jefferson County at this point?
Yeah, don't have exact numbers for any of this, I'm afraid. We're waiting to get to those from the state, and it's sort of moving faster than we can keep up with numbers. But we feel like we're pretty close, and maybe just a few days away from getting pretty much all those that are seeking it right now. Now, there are a few people that are in that 1A category that have chosen not to get vaccinated initially. A few people are just sort of waiting. Some people have just scheduling problems and have not been able to get to a vaccine site when they're not working, things like that. So there'll be some more in 1A that'll be circling back for sure. But we think we're getting really close. And that's what I mentioned earlier about how we're going to get with our other partners that are providing vaccines. You know, if we find there's still a group that, say one of our hospitals that still hasn't vaccinated all their people that need it right now, and one of our other hospitals has some vaccine, or the health department still has some, then we'll make sure we get to those, and then all say, okay, we're good, let's move on to these 75 years and older and these other first responders. And let me also just mention, when we say we're moving to a next phase, it doesn't mean we're closing the door on the first phase. We'll be doing 1A plus additional people starting at next Monday at the latest. Over here, yes, sir.
Dr. Wilson, are we ready to go and add more people at this time, or should we take care of the rest of 1A first before we add to that?
We're not quite ready at this point in Jefferson County. And you know, there are some other counties who have made that determination that they are, you know, have been ready to go on. And from the state's perspective, you know, we're in touch with the state health department. We have regular calls with them. Basically, the decision has been made, you know, we're not going to try to move through the phases statewide across the board, because some counties are going to meet that demand in a phase sooner than others. You know, we have a lot of healthcare workers in Jefferson County. Obviously, we have a lot of flagship hospitals, a lot of healthcare here. So it's taking us a little longer than, you know, a few of the rural counties, for example. But I think we're getting quite close.
Given that, if people call today, tomorrow to register, how soon can they possibly be vaccinated if they are 75 years and older?
Yeah, and I want to make a point about this word register. We were just talking about this earlier. What we're doing is just to be more specific, we're taking people, first we're giving people's information. So if somebody calls and they're in phase 2 or phase 1C, we're just letting them know, hey, we're not there yet, you know, check back later. But if you're in the current phase, or you're on the, you know, you're on those 75-year-olds, then we'll take down your information, including an email address, if at all possible, and make sure that we've got and we're keeping a list, all right? And then as we see other vaccination sites open up, or maybe we're standing up a site, then we can connect people via, we can give those email addresses to whoever's offering the vaccines, and then they will reach out and say, here's how you make an appointment, okay? So that's kind of how that's working. So just to be really clear, you're not going to the call center and making a vaccine appointment. You're just getting on a list. And the idea was, from the beginning, we were concerned that, you know, certain people are vaccinating and they may not be thinking of everybody in the community that fits in that category. We just wanted there to be a way that we capture their name so they don't get left out. Did that answer your question?
So it's not a week from Friday or something?
Oh, I'm sorry, I did not answer that question. Yeah, I think, well, it's going to be hard to say, but, you know, some people who are in this 75 years or older, or who are, say, law enforcement, should be able to start getting vaccinated next week on Monday. We will have, you know, some vaccine in the community to do that. Will it be enough? No. So there are going to be some people that are going to be waiting a while to get their vaccine. It may be a couple weeks or maybe even a little longer before they can actually get vaccinated.
Is that going to take place here, mainly those people getting vaccinated?
So, no, we're doing some here, and then multiple others are doing vaccination. And as I mentioned, we're going to have some other entities, healthcare providers, will be receiving vaccine pretty soon and able to pitch in as well.
Is this going to be similar to some of the locations throughout the county that are also administering the COVID-19 tests, whether it's a urgent care location in your community or a local pharmacy, CVS, Walgreens, that sort of thing? Are those going to be the kind of venues where people will be going to get the test or the vaccine?
Yes, there'll be some places where there is a doctor's office or an urgent care center that has gotten the vaccine. There'll be a few pharmacies that are doing it. And then we will be setting up, and others may be setting up, what we call open pods, or a large mass vaccination site where we might try to get 300 or 400 or 500 people done in one day at one site. And we're still determining exactly where those are going to be, but we should have that information coming pretty soon.
But people they will know once they call what day, when and where I'm getting that, and they'll know that relatively quickly, or if they got to wait.
No, when they call the call center, they're not going to be told immediately, here's your appointment for a vaccine. We're putting them down on a list, again, to make sure they don't fall through the cracks, and then they would get notification later, here's an opportunity here is an opportunity to make an appointment. with such and such a vaccinating provider. And there may be times when we can say, hey, we've got a place today, you can come right on over. That might happen at some point, but right now it's mostly keeping a list and circling back.
And they can do that via calling the call center or registering online.
That's correct. And the online is a lot easier, but we wanted to make sure that people had a real live human they could talk to, because this is pretty frustrating for everybody, who's desperate to get a vaccine, trying to find out, number one, where are we, what's the status, what's going on, and then how can I get it? So we wanted people to ultimately be able to talk to somebody. So when you call, there's some information that you'll hear that may answer your question, but then if you want to stay on hold and talk to a live person, we're trying to make sure there's a live person for you there.
In your call situation, you won't be overwhelmed like the state was?
We've come close to being overwhelmed. We're getting a lot of calls, but that might be an answer for the EMA. You want to comment on that?
And Alan, that's a good question. Thank you. At 8 o'clock every morning when the call center opens, Monday through Friday, the phones immediately begin ringing and they do not stop ringing until the end of the day. We take as many calls as we get. We did open the registration portal, the green button on our website, to help alleviate some of this, because sometimes people will call and then they'll call back to verify that they actually got on the list. Well, yes, you did. So we encourage people to use the portal on our website. But if you have a question or if you want to talk to a person, feel free to call the call center.
Do you recall what those numbers are again, the numbers you've gotten since?
Okay, the 13,500 via registration on our website and over 3,500 calls via the telephone call center.
The call center's open 8 to 5, Monday through Friday.
Yes, sir. That's correct, Jonathan.
Is there any thought of expanding that?
There's always a thought. That'll be based on need. But right now, after hours and on the weekends, people can certainly go to our website, click on the green button, and register. We did receive 10,000 calls like that over the weekend, or registrations over the weekend.
Dr. Wilson, I guess that question follow up you. Expanding it, going Monday through Sunday until 9 o'clock at night, or is that?
I think right now it's a matter of having the staffing to do it, we're still building it as we go. So all that we felt we could do right now was those regular weekday hours. This is a rapidly evolving sort of thing, and it's happening fast, and there are a lot of challenges. So there is, some building it as you go type work going on here.
Any other questions? Final remarks?
Any other questions?
Have you seen the variant yet here in Alabama or Jefferson County? I can speak to that.
Yeah, Dr. Hicks will speak to that one.
Yeah, so the question is about, have we seen a variant? We hear all this news around the world in certain parts of the United States. In Alabama, it has not been detected. Remember that, COVID-19 doesn't have any boundaries, so it can get in and out of the state. And it may be here, and we may not have picked it up yet. So we don't know, but it has not been detected yet. One important thing to note is that throughout the state of Alabama, there are certain labs that have been doing the sequencing work to be able to detect which strain is out there. So that is actually going on. It's been going on for months now. So there already are labs that are doing testing as we speak, and the state health department is trying to bolster up that surveillance system to do, they call it genomic sequencing. So that's what's happening right now. One really important thing before we go, it's just a quick reminder. Remember those 3 W's. So wash your hands, watch your distance, and then wear your mask. That's something we have to do. And then the last thing will be get vaccinated when it's your time. Thank you.
Can you hear me?
Yes. Go ahead.
This is Mary Scott Hodgin with WPHM.
Yes.
I assume you can hear me. I was just curious how far out you're able to plan right now. I'm not sure if you know when you will get more vaccine allotment, but that seems like sort of a logistical challenge, is not really knowing, what numbers you have and how far out you can plan right now for vaccinations.
Yeah, the question is how far out can we plan and how do we know how much vaccine we're going to get? And that is an issue. We do know that we'll be getting more vaccine, and I think we'll start to see the amount of vaccine over time it become more plentiful over time, but we do not have any set guarantee how much vaccine we'll get, say, next week or the week after that. We request a certain amount, and then we may get all of that amount, or we may give some subset of that, because the state is allocating this, through the entire state, through multiple entities. So that's just the nature of the beast, but that's what we have to do. We have to plan accordingly and with a little bit of unpredictability at this point.
And then I had one other question about scheduling follow-up doses. Each of these vaccines require 2 doses. How does that work? Is that sort of already in the cards? Like when you get your first vaccine allotment, they say, okay, come back in 4 weeks or 3 weeks or however?
Yeah, different entities are doing it slightly differently. Some are going ahead and making that next appointment for you and giving it to you, and then others are saying, we will get back in touch with you on or after this date. And people need to understand, for the Pfizer vaccine, it's 3 weeks after your first dose. For the Moderna vaccine, it's 4 weeks after your first dose. But if you get it sometime after 3 weeks or after 4 weeks, respectively, that's okay. You may have heard that the incoming Biden administration is talking about the possibility of releasing more vaccine for that first dose, not necessarily having the second dose held back, and taking that risk just to get more people vaccinated initially. So we may have a scenario like that where we don't know yet when your second dose will become available, and that's where we'll have to set up, we'll have a system where we know who you are, and then when we know we have vaccine for you, we get back in touch with you about another appointment. And it might not be 4 weeks, it might be 5 or 6 weeks, but that's okay. It means you don't get to that ultimate immunity until a little bit later, but it does mean you will be fine ultimately, and it will still work. Okay, I think, are there any other questions for me? One more?
Catherine, are you there?
Okay, let me just wrap up by saying, again, people need to be patient. I think, though, we're just getting started with this, with a limited supply, with very limited number of vaccination providers, but we are going to see it really mushroom over time with more and more providers, more vaccine, and we should see this start to accelerate. But the overall process is still going to take a very long time because we have obviously the entire population to ultimately try to get vaccinated. So thank you very much for your time. We'll be following up with more information as we have it and try to keep the public really well informed as we go along. Thank you.